Hello and welcome to the very first episode of The Climate Prescription by the UK Health Security Agency, hosted from COP30 in Brazil and from around the world. I'm Kanza Ahmed, and when I'm not trying to be a podcast host, my day job is Head of Global Disasters, Climate and Health at the Centre for Climate and Health Security at the UK Health Security Agency. Now, for those of you who have never heard of the UK Health Security Agency, in short, we are the public health agency for England. And essentially what we do is we work closely with our partners in Wales, Scotland and Northern Ireland to protect the health of the nation. And our role is to prevent, to prepare and respond to infectious diseases, environmental issues, radiological, chemical and climate hazards. So we're very busy trying to keep communities safe and to save lives and to protect your livelihoods. Now, the Centre for Climate and Health Security is actually the first climate and public health specialist centre to be hosted by a public health agency. And that's because we recognise that the health impacts that arise from climate change are essentially public health impacts. So that neatly brings me to the topic of our very first episode, COP30. Now, you may have heard this week that COP30, the world's largest climate conference, kicked off on Monday, and it came with much fanfare in Brazil. Now, many of you tuning in today have probably heard of COP, but probably don't know what it means and are probably wondering what's it got to do with you and why should you care about COP? So if you want to know more, stick with us today, and between us, we're going to decode what COP is all about and why you should care. Now, today I have a great panel joining us, and we've got guests from around the world, so it's truly global. Directly from Brazil, and at the heart of the action at COP, we have Alan Danga, who is Director of Climate and Health at the Wellcome Trust. Welcome, Alan. Good to have you here. And then, all the way in Ghana, we have Benjamin Dovey, who is Professor at the Regional Institute for Population Studies at the University of Ghana. Welcome, Benjamin. Good to have you on board. And here in the rainy UK, we have Chris Gormley, who is Chief Sustainability Officer for the NHS. And if that isn't enough for you, you can also join us via menti.com using the code 29 28 25 58. That's 29 28 25 58, where you can pose questions, comments and suggestions for future episodes of the Climate Prescription. But now we are going to dive straight in, and I'm going to go straight to Alan and ask the very basic question. Alan, what is COP?
Well, that's actually a very good question. COP stands for Conference of the Parties, and it's where countries come together. All the countries around the world are invited to attend the COP every year, the Conference of the Parties, to talk about climate. It's the place where countries debate how to respond to the climate crisis. They debate how to reduce greenhouse gas emissions. They debate how to adapt to climate change. And increasingly now, thankfully, they're beginning to talk about health. Famous COP, the COP started in 1990 in Berlin. In 1995 in Berlin. That was COP1. Probably the most famous COP was COP21, which was the Paris COP, which led to the Paris Agreement, which was an agreement in all the countries to do everything they could to stop the temperature rising by more than 1.5 degrees from pre-industrial times. So that's the most, and we're now 10 years post-Paris. And since then, actually, the most important thing I think that's happened is that COP28, which was in Dubai, held the first ever thematic day on health. And just yesterday, there was another thematic day on health where the COP Brazilian presidency announced a major health action plan. If I give you a little bit of a taste of what it's like, these are massive events. This year in Belém, there are nearly 60,000 people. This is a huge venue. It's a sort of, it looks a bit like a warehouse. It's in a massive venue. And there are pavilions. Countries have a pavilion, a sort of like a show and tell place where you have talks and everything. And then you go. There's lots of security, and you go in, and then there are these pavilions, and then there are enormous plenary rooms. I was speaking in a plenary room yesterday, which had 1,200 seats. These are massive rooms. And then in the back, there are all these negotiating rooms where the countries come together to negotiate the text and negotiate how they're going to respond to climate change, what they're going to do. So there's all these little bits of the building, all these little bits of COP, where different debates are being had. I mean, it's quite a whirlwind, and it's exciting.
It sounds like it's been keeping you busy, Alan. And one of the things that I think many people will have been reading about is this concept of the green zone and the blue zone. What does that mean?
Well, that's great. So I mean, to go to a COP, you have to have a pass, and they're quite hard to get. And if you're a country delegate, you can get a part. You can be you're a member of a party. You remember it's called the Conference of the Party. So you're a member of one of the parties if you're a country delegate. But then also you can be an observer. So I'm at the Wellcome Trust. We're not a country. We're a philanthropy, and so we can apply to be an observer to COP. And so you can attend. There are some bits of the building you can't get in. There are other bits you can get in, and you can observe the processes, and that's quite nice because it shows it's about transparency, it's about openness, it's about multiple voices. But there are thousands of people who can't get in at all, and so if you get in, you get into the blue zone, which is the protected zone, which is run by the UN, and there are UN policemen on the inside. It's a whole different space. And that's the blue zone. And then there's the green zone, which is a much more open zone, which is for people. So there are, again, loads of pavilions and loads of stands and people talking and events happening, and that's open to the public. So it's an attempt by the COP, by the Conference of the Party, to have a protected zone where the negotiations happen, where the heads of state arrive, and where those delegations are. And then another zone which is much more open for the non-governmental organizations, for members of the public who want to observe and engage and start talking about climate.
Excellent. So that's helped to give a picture of what's going on. You talked about the country, so I'm going to go over to Benjamin now, over in Ghana. What's Ghana's role in COP this year? How are they engaging with COP?
Well, thanks, Kabza. Yes, Ghana has been participating in a COP for over years, and as a big negotiating partner and part of the G77 group. And so, first and foremost, it's important that we engage also in the negotiations. So Ghana really is negotiating on a lot of things, and this year I can imagine that climate finance has been key, and we have people in there that are trying to making important statements as far as climate finance is concerned, because that's one of the areas that we are looking at. So that's number one. Number two, we also going to have the days, party days, countries having a specialized or set aside day for them to exhibit, to demonstrate, to make political statements. It's very important to the COP process. So we have various ministers present. We have various CEOs, many important organizations in Ghana who will be making important statements at the Ghana Abse Pavilion within the ECOWAS Pavilion at COP. Then, thirdly, and the most important thing that Ghana is going to participate in is the side event, which basically is being driven by some of us here on Sushi, a project that we've been working on. And there we try to demonstrate how we can establish indicators to look at the impacts of climate change on health and look at the interactions much deeper and maybe dive much deeper into the policy implications. And that will be key for us. So definitely you can see that Ghana is really participating in our front as far as COP is concerned. Thanks.
Definitely sounds like it's a busy time for all levels of those involved in COP from Ghana. You touched on SOSG. I'm going to pick up more on that. So for those of you at home who have not heard of SOSG, this is a project known as the Standards for Official Statistics on Climate and Health Interactions. It is funded by the Wellcome Trust, and it's a joint project between the UK Health Security Agency, Ghana, Rwanda, and the Office for National Statistics in the UK. And the idea is to develop a series of official standards for statistics and indicators when it comes to climate and health. So when we talk about SOSG, that is what we are talking about. I'm going to try to explain any acronyms that we come across. We'll pick up with Benjamin in a short while, a bit more about SOSG and why statistics and indicators are important. But I'm going to come back to home territory and bring in Chris into the conversation. Now, when I introduced you as the Chief Sustainability Officer. Quick question, what do you actually do?
Thanks, Kanza. Yes, what do I do? Look, important that our listeners understand the impacts of climate change on health, first of all, and UKHSA themselves project that the cost of climate change on the NHS will rise over the next few decades from in terms of heat-related mortalities and wider socioeconomic costs from 7 billion to nearly 17 billion. Alongside that, global projections are going to see that suggest that heat-related mortality will rise by 11,000 people without adaptation or mitigation by 2050. We're going to see increases in vector-borne diseases. We're going to see the impact of heat, floods, and that impacts the health of our patients, but also the ability of our healthcare systems to deliver care. So the NHS, quite proudly, in 2020 was one of the first health systems to commit to net zero. We introduced published a net zero strategy, which set two really key targets, which takes us out to 2040 in terms of cutting the emissions we're directly responsible for, and out to 2045 for those that we can influence. And those emissions spread right across our footprint is significant. We're one of the biggest employers in the world, one of the biggest organisations or set of health systems or organisations. And that cuts across our estate, our fleet, the medicines we use, our supply chain, which is obviously significant. So I guess what's my job? I'm responsible for delivering those targets. I'm responsible for decarbonising the National Health System, and also responsible for delivering better patient care as well as part of that, and increasing the efficiency of the NHS, which are all mutually beneficial to reaching our decarbonisation targets.
That sounds super interesting. It is not something I think the public would associate the NHS as being part of. It's really interesting to get that insight. I read this interesting statistic, in which it said that if all of healthcare across the world was one country, it would be the fifth largest emitter of carbon. Is that correct?
Yeah, I think we estimate healthcare globally to be around 4 to 5% of emissions, which is significant. The NHS itself compares to some fairly developed countries. So yes, it's a key part of the problem, as well as the trying to find a solution. So we do have a responsibility to reduce our own footprint.
Yeah, that's super interesting, and I think it's great to have that insight into what the NHS is doing, and people better understanding how healthcare contributes to climate change emissions. I'm going to move back to Alan, right? We're talking about jobs. I'm going to ask you about your job, right? I introduce you as the Director of Climate and Health at the Wellcome Trust. What is the Wellcome Trust, and what do you do?
Well, that's a great question. The Wellcome Trust is a global philanthropy. We're based in London, but we act globally, and the mission is really to solve the urgent challenges, the health challenges facing everyone everywhere. So, and we focus on research. We fund a huge amount of research every year in sort of four main areas. One of them is discovery science, which is fundamental biology, cell biology, immunology, neuroscience, those sorts of really detailed, long-term research activities where you're really building up our knowledge on human health. And then we have three other areas which we focus on, which different to discovery. They're much more focused on short to medium term impact. And those are work on mental health, work on infectious diseases, and the program that I lead, which is the work on climate and health. So Wellcome has stepped into, over the last 4 years, to really step up scientific discovery, scientific research on the intersection between climate change and human health, and using that evidence to drive change and to protect people from the impacts of climate change.
Sounds like a big job. And what's it like how much sort of money does Welcome have to be able to invest in this?
That's a great question. Well, Welcome made a public commitment 4 years ago to spend £16 billion over 10 years on those 4 areas: discovery, mental health, infectious disease, and climate health. So that's a public commitment. And if you look at our annual reports, I think last year we spent 1.6 billion. So, these are huge amounts of money. It's an enormous injection of money into research, really, really targeted efforts. So I lead the program at Welcome on Climate and Health. That means I set the strategy, I direct, I have a fantastic team that I work with. But we also, so we fund a huge amount of research, but we want to use that research in new ways. So not just here's a piece, let's do a piece of research, let's put it in a journal, in an academic journal. We want that research to be used. And so we fund research across the world and ask our research teams to, how are you going to use this research? How are you going to use the evidence you're generating to influence change? Whether it's by talking directly to a policymaker, whether it's by helping a policymaker write a new policy, or whether it's to use that evidence through creative and cultural means to talk to people, to engage in different ways, to write a play, to put a football game. There are many, many different ways you can use scientific evidence, research evidence, to influence change and to influence people's understanding of the issues and have an impact.
Yeah, and I think that's so important, that final point around the impact. We've got a load of research, but for the ordinary person who goes about their daily life, what impact does any of this have on them, and why should they care? And it's great to hear that Welcome have made that actual real commitment and very public commitment to make a difference. I wanted to move on to a quick fire round. But we are now halfway through the show. So if you have just joined us, where have you been? You have missed out on some really interesting conversation, but never fear, because this is YouTube. You can rewind and you can watch us again and you can join in. But I'm going to have a quick fire round and bring Benjamin back in as well. And I'm going to ask you, if you were talking to your next door neighbour about COP and you had to describe COP using one word only, what would you tell your neighbour? Benjamin, if you're there over from Ghana, what would you tell your neighbour about COP? And if he's not online, we'll go to Chris instead. Chris, what would you tell your neighbour about COP?
Crikey. In one word, it's a tough one.
Hyphenated.
Well, look, I think hope is a really good word at the moment. I think it's no secret that the climate debate is kind of polarized in some parts of the world, and it's quite difficult actually for a lot of people at the moment to talk about climate change to their neighbour, because they don't quite know what they think about it. And certainly in the UK, there's difference of opinion, but I think it's really important that we continue to hold COP and push the agenda. It really shines a spotlight, and I sort of feel that at this point of every year, there's just a moment where everyone does kind of pull together and say, actually, yes, I do have to think a little bit more about the future beyond the sort of next week, 6 months, year, and I think COP does offer a little bit of hope to be able to make progress.
Hope is a very powerful word. I like that one. Welcome, Benjamin, over from Ghana. So, if you had to describe COP in one word to your next door neighbour in Accra, what word would you use to describe COP? Oh, I think we've just lost him again. So this is the benefit of having a virtual podcast, is that sometimes technology likes to have an influence as well. So I'm going to quickly move over to Alan. Alan, in one word, you are there. How are you going to describe COP to your neighbour? I
would go with opportunity. It is a unique opportunity for countries to come together. It's every year we have all countries together for 2 weeks to talk about climate. It's a massive opportunity.
Opportunity. I think that's also quite powerful.
All right, so can we do?
Benjamin back. Hello, Benjamin. Hopefully you can hear us. So we were saying, describe COP in one word for your next door neighbour. Hopefully you can hear us.
It's bringing hope.
Hope. Oh, yeah, see, we've already had hope, so that's interesting.
Yes, I can hear you.
The experts talking about hope. Go ahead, Benjamin. You there, Benjamin? Can you hear us? Or have we lost you again?
Yes, I can hear you.
Yeah, we were saying...
Come again.
Hope in what way?
All right. Well, I think we're looking at the issues more reality. Can you hear me? Yes.
Yeah,
we're looking at linking the issues of climate change more and more to social systems, social issues, population dynamics, very key. And for example, we've moved from loss and damage and now onto adding health, climate and health interactions is very key at COP because.
Oh, he's left us on a cliffhanger, guys.
And
why are climate and health interactions important? We'll try and get Benjamin back in a minute and get the answer to the question as to why climate and health interactions are important. But Alan, every time I fly out to COP, as far as my parents are concerned, COP is just something that I go to and have some meetings and come back. If you were chatting to my parents, and you're going to tell them...
love to meet your parents.
You can come round for a cup at any time. If you were chatting to my parents about COP over a cup of tea and a biscuit, what would you tell them I'm up to? What would you tell them it's about?
You know, it can seem a bit distant. It can seem a bit, not really linked with everyday life, but it's fundamental to how we're going to survive on this planet. You know, a process, a global process where all countries come together to discuss to recognize that climate change is real and is happening at pace, to recognize that countries have a role to play in stopping that climate change because the impacts are so enormous, and then to develop plans and agreements whereby countries will act in a concerted way, in a unified way. To respond to that climate change. It's really, really important, and I think I think we're very lucky to have this sort of process because it is the only place where these sorts of discussions happen. All countries come together. Of course, some countries don't participate sometimes and whatever, but all countries come together. It gives a voice to people. It gives a voice to countries who often are marginalized, but everyone has an opportunity to speak. The big plenaries, these are massive rooms where every country has a seat with a name, and they have an opportunity to speak. And you get the views from around the world. I think it's critical. It is a little bit difficult to understand what the purpose is and what it's trying to achieve. But that sort of sense of unified action, that sort of sense of coming together as a global community, that sort of sense of recognizing how important an issue this is, and we can only solve it if we all work together. That's what you get out of these conferences. And I think that we would be let's be clear. When the process started, we were on a trajectory to reach 4 degrees of warming. So that means from pre-industrial times, the world was going to be on average 4 degrees hotter. And of course, the world, not everyone goes up 4 degrees. Some people will only go up 2 degrees, but some people, their temperatures will increase 6 or 8 degrees. This is catastrophic levels of heating because of the process, because of the COP process, and because of the have made and the transitions that have already taken place in many countries. We're now on a trajectory to reach 2.5 degrees of warming. 2.5 degrees of warming is still really bad. It's still pretty catastrophic for many countries around the world, and especially the most vulnerable communities. But it's not 4 degrees. So I think the COP process is working. It is slow. It is difficult. It is very contentious. It is, all sorts of things go on in these rooms. But we can see that this opportunity, that's why I use that, this opportunity to meet every year for 2 weeks to really thrash out a plan is one that is working and is one that is really, really important for our future on this planet.
That's, I think, a really good comprehensive answer, Alan. Might even earn you a second biscuit from my mum. Nice one. I think, yeah, I think it's really difficult when you're in COP to be able to explain to people outside of COP how complicated it is, how busy it is. Imagining 60,000 people in one space, everybody having conversations and everybody coming with their own agenda and perspective. And how do you satisfy everybody? You know, you think about Christmas and having your family round, and how you try and satisfy everyone just having a menu that everyone agrees on, and that's 10 of you.
Exactly. And this COP is actually extraordinary because there's such a strong indigenous voice in Brazil.
Absolutely.
And there's an enormous number of indigenous people and representative of indigenous peoples in the blue zone. So as official observers, it changes the dynamic. I mean, in full headdress, in full body paint. I mean, it's quite extraordinary. And I mean, I've been to many COPs, and you often see the occasional indigenous person in full in their traditional wear. But here, it's been quite extraordinary, and that's the opportunity here. That's where you hear these voices, you raise new issues. I mean, it's a critical part of how the global community is going to work together.
Absolutely. I think, the big challenge for us is how do we translate what happens at that international level to make it a reality for people at that local level as well. And sort of one of the things that Alan and I have been talking about outside of this is actually how do we translate the learnings and the recommendations from COP. And one of the things that we're going to be doing in the UK next month is actually jointly with the Faculty of Public Health, the UK Health Security Agency, be hosting an event in which we are going to attempt to translate what all this international abstract climate change concepts mean for the local level and how we can actually have a positive impact on local people. So speaking of local people, Chris, for most people, their interaction with healthcare in the UK is through the NHS. Or through primary care. How does having a greener NHS make the patient experience better?
Great question. Look, in many ways for the patient, it's quite invisible in some ways. Certainly from a long-term perspective. So as a patient, you go in for your hip replacement, you're not thinking about the impact of that procedure on future generations and the cumulative effect of those procedures. And I think so it's quite hard to articulate the long-term benefits of what we're doing, but actually there's quite a significant number of short-term benefits. I talked about how what we do sort of hits every bit of activity in the NHS. And to take a few examples, so we've recently partnered with the Department of Energy Security and Net Zero and Great British Energy to install solar panels across our hospital estate. £130 million for this year across nearly 250 sites, and that will pay back more than 3 times over. It's a very conservative estimate. That money goes straight back. I mean, we have an energy bill of £1.4 billion in the NHS. That needs to come down. By reducing that, you're putting that money straight back into frontline care, into patient services. So it's similar with our fleet. We have the second biggest fleet in the country. Electrifying our fleet will save nearly £60 million a year in operational costs, but then you start to think about the wider costs, and we estimate in terms of air pollution, reducing air pollution, the wider benefits are closer to £250 million a year. So it's significant. Just making those kind of key changes to our estate and our fleet can reinvest in frontline services. But even in our clinical transformation space, the medicines we use, I think we've estimated that some hospital trusts nitrous oxide waste, which is a really powerful greenhouse gas. It can be upwards of 80-90% in some cases, and we've undertaken projects to to reduce. That's harmful gases to both our patients, to our staff. But it's also costing millions of pounds a year, and we've implemented a project to reduce that nitrous waste. And actually, we're seeing really positive clinical experience, and the buy-in from clinicians, our staff, nurses. It's just fantastic. We know that 9 in 10 people in the NHS want to do something to lower our carbon footprint, to take action on climate change. So it's a really powerful issue and initiative for our staff, and really helps with staff engagement. So the benefits are wide. It's not just the future benefits that we'll feel, hopefully, as a healthcare system, but there are real immediate benefits.
Well, I mean, there's some absolutely strong numbers coming out of that, and I think, being able to communicate that with the public and so they understand what the benefit is really important. But I think the key message around being able to reinvest that money back into frontline services is, if anything, the basic reason why we should be doing this, let alone everything else around the environment being better, and people just having a nicer experience and their health benefiting too. I'm going to come to a final question, right? We are deep in the Amazon. I'm not, I'm in Birmingham, but Alan, you are deep in the Amazon, right? On your travels, you find a lamp that contains a genie, and you get to rub that lamp, and the genie comes out and says to you, hey, I will grant you one COP wish. What's your one wish?
Firstly, that all the food in the world is as good as the food in Berlin, because there's some fantastic food here. So that's number one. But if I was allowed a second one, it would be.
I can confirm the food in Brazil is excellent from an
unbelievable. So many flavors, it's astonishing. But no, I would go. So obviously, I'm going to say health. We've had an awful lot of COPs where we've talked about greenhouse gas emissions, we've talked about nitrous oxide, we've talked about carbon dioxide, we've talked about all these things, and degrees centigrade, and we've lost, and they didn't, what's really important is to be switched that to something which you and I can understand, and your parents and your children can understand. So what is the impact that is going to have on me? And the clearest impact it's going to have on all of us is the impact on health. Chris mentioned this earlier: extreme heat, the moving of diseases like malaria, impacts on the ability to grow foods, impacts on mental health. There's so many ways in which the climate change is going to affect our health. So the wish would be, and that's why Wellcome is here, that's why Wellcome attends COPs, that's why Wellcome is funding all of this research, is to say, let's get health evidence into the heart of climate action. Let's get health evidence shaping what those climate policies are going to be. The future is going to be shaped by massive climate policies, which are going to shape everything we do on the planet. So let's make sure that health forms a strong part, a central part of those policies. They'll be fairer, they'll be more transformative, and they will drive the urgency we need. So that would be my wish. Let's get health absolutely at the center of climate action.
I mean, I would, as somebody working in public health, absolutely sign up to that. Benjamin, what is your one wish from COP this year?
Well, this is to inspire public action and behavior change. And if we are able to inspire that, it'll be good for us, because we've heard about the heat surging, the weather, and the warmth and so on, meaning we can have good health early warning systems and be able to work together in partnership with several other organizations to be able to change, to turn around the rate at which we are going. So that's my wish, to inspire public action and behavior change, not only from individuals, but also from politicians. So we need big statements in that direction. And the evidence that is key for that kind of inspiration is also needed. And that is why we need our events on social, for example, to be able to inspire that public action, because knowledge is very, very important.
Absolutely. That's strong words, Benjamin. Strong words. And Chris, what is your one wish from our genie?
Gosh, I feel like I don't know now, because Alan and Ben have already wished for it. I feel like I need 3 more wishes. Yeah, look, I think the integrity of COP is really, really important. So I think the more and more that the science and the numbers are replayed and communicated effectively, I think, as Alan was touching on it, I think it's just so important that the comms that come out of COP are really, really strong, and the integrity of the event remains. Kanza, I think you've dodged some of these questions about your wish. What are you wishing for?
Ooh, look at that. It's all turned back on me. I mean, I again had a lengthy wish list about what I want from COP this year, but for me, I think it's a culmination of a cumulative action. It is about inspiring, as Benjamin says. Obviously, to get health higher on the agenda, for me, it's always astonishing that it took about 26 COPs before somebody talked about health. And actually, people understanding that health underpins everything we do. We cannot have a strong economy unless you have healthy people. We can't think about our energy distribution unless we know how healthy our population is and how that energy is going to need to be used. I mean, what you were saying earlier, Chris, around energy usage in the NHS. If we have an unhealthy population, that energy usage for the NHS is going to increase. So be able to think about health at the heart. But my number one wish, I know I'm thinking about 10 wishes now, but I'm slightly greedy here, is actually for health to be discussed in non-health spaces. So those people that are working in agriculture, in economy, in finance, to also be thinking about health, because actually that's the one thing that every single person has relevant to them. It's their health. And that is how we can inspire them. So that's kind of my wish list. Basically, we're going to be keeping this genie very busy. And, and I think it's got to be, because I think one of the things that I feel about COP is that actually with 60,000 people, there are 60,000 wishes, but actually it's the wishes of 8 billion population who all want something out of this because they need improvement and they need change. And, last year's COP, I heard a great phrase and, said that the time for action was yesterday. The next best time is now. And I think we sums up what COP is all about. I would love to continue talking about this, but unfortunately, that is all we have time for today. Thank you for joining us and for listening in, and thank you to our guests, Alan, Chris, and Benjamin, for talking about COP and why it matters for everyone and not just the experts. It's not just about professionals. Now, for those of you watching at home, we really hope this has helped you to understand better why COP is important, but also explain a bit about the complications that sit behind COP and why it isn't so easy to describe at times. This is not the only thing that's going on at COP. So if you want to hear more about what the UK is doing at COP in Brazil, stay tuned on our YouTube channel and over the next week or so, and you will continue to hear about the excellent work that's happening across the UK and what the UK is doing globally as well. Now, we really hope you enjoyed this episode, and we hope you're able to join us for future episodes. Until then, stay safe. And remember, every single one of us can make a small change that can lead to a big improvement. But for now, I'm out of here, and I will try to leave no carbon footprint on my way out. Goodbye.
Thank you. Bye-bye.